You're watching TVC News. In the past 2 decades, cardiovascular diseases like hypertension, heart failure, and stroke have been estimated to be under increase in Nigeria. In 2016, the World Health Organization revealed that non-communicable diseases were estimated to account for 29% of all deaths in the country. And out of this number, cardiovascular diseases contributed 11%. Health correspondent Kemi Balogun has more.
Globally, over the past decade, cardiovascular diseases are the leading cause of deaths, with an accelerated increase in CVD-related deaths in Nigeria and other low and middle-income countries, largely made worse due to poverty and malnutrition. The mortality rate from cardiovascular diseases was expected to double between 1990 and 2020, with about 82% of the contributions from developing countries like Nigeria. Over the past 2 decades, Nigeria has been experiencing an accelerated increase in CVD, mainly in hypertension, coronary heart disease, stroke, congenital heart diseases, among others.
8 children out of every 100 children are born with congenital heart disease. They have a hole in the heart and other conditions of the heart that require intervention. And because of our fertility rate in Nigeria, we have over 55,000 children born every year with heart disease, holes in the heart, every single year. And this is different from acquired heart disease that comes from infections and lifestyle, hypertension and all of that.
In developed countries, 50 to 75% of deaths from cardiovascular diseases occur out of hospital, while in Nigeria, where the patronage of orthodox health facilities is low, the impact of cardiovascular-related diseases on out-of-hospital mortality is higher. This 5th annual scientific conference of the Association of Cardiovascular and Thoracic Surgeons of Nigeria is seeking better outcomes for cardiovascular patients. This move is starting with the First Lady of Nigeria, who is represented here. She is seeking more local and international collaborations with organizations to provide trainings and equipments in order to provide world-class surgeries for citizens in need who cannot afford the huge cost.
The activities of my initiative, Future Assured Foundation, has afforded me the opportunity to collaborate with members of your association during our recently concluded cardiac surgery missions, where 10 children and 12 adults successfully had open heart surgeries and cardiac interventional procedures, respectively.
As Nigeria's health sector continues to suffer the lack of proper funding and support, these cardiothoracic surgeons are urging for more confidence in cardiac surgeries carried out by Nigerian surgeons. They believe that this will help to reduce the cost of surgeries and boost the morale of Nigerians who are suffering from this disease.
You may have all the infrastructure, you may have the staff, but then when it comes to the real surgery, people may not be able to afford. And therefore, most of the centers rely on missions. From time to time, when you have cardiac missions, you now enroll patients. And then occasionally you have walk-in patients that come routinely. But then those numbers are quite small. So we need sustainability of this, and therefore we need to look inwards.
The Axon Cardiac Mission team, if utilized by hospitals in Nigeria, will help reduce the high cost of getting foreigners into Nigeria for cardiac surgeries, as well as removing the impression, which is a real impression in the hearts of our people, that cardiac surgery can only be performed by people of fairer skin color.
This 5th annual scientific conference of Axton focuses on the burden of cardiovascular diseases in Nigeria with the theme Cardiovascular and Thoracic Surgical Practice in Nigeria, Sustaining New Frontiers. Kemi Balogun, TVC News, Abuja.